how did the pandemic shape a lot of what your team strategy was thinking about?
As we all know, in the U.S., we saw a really significant shift into virtual care. And when that shift into virtual care happened, we had really never had a patient experience where patients that were very complex to manage were trying to be managed in a virtual way. And that was putting strain on the healthcare system. And for us, we wanted to make sure that we stayed had a close connectedness with our customers. So we actually have a multitude of advisory councils across Pfizer and our folks that work on the front line with all of our clinicians and our health systems. We started to get an outpouring of insights, really beyond the four walls of Pfizer, that this was really starting to become a strain because many of these patients were scared to come into the offices and be treated. They were even scared to go into emergency rooms. We saw stories surfacing where patients were having serious and catastrophic events such as strokes and heart attacks and still were hesitant to even go into an emergency room. So when we looked at conditions such as AFib, those patients need to be anticoagulated. They're very used to entering back into a clinical environment very regularly to be monitored, to be educated, and that's just one example. But those patients were coming into that environment to make sure they were getting that ongoing education. So that was an example where we really leaned in and we said, how is this transforming the way that you're engaging with patients? How are you starting to train your care teams in really different ways to virtually engage with the patients? And we really did this across our therapeutic areas and a multitude of populations. And a lot of the executives that we work with, we have one advisory council that's about 20 to 25 different executives across health systems, the top 100 in the U.S., and many of these individuals are chief medical officers, chief quality officers, running their informatics departments. And we usually meet with them about once a month. We completely rewrote how we were going to be engaging with them to understand now how their positions were evolving. And many of them were also leading task forces for COVID, or they were leading different sub teams within the COVID task force. So they were really able to share with us how this was impacting the way they were approaching the management and the risk for COVID, and then how it was having this halo effect of how it was impacting their care management across their population so we could partner in really different ways.